Our practice philosophy is based on 5 levels of care. And this is something that's kind of been developed in the trenches over time. I guess when I first started practicing, I would bring people in and I guess intuitively knew where they were, but it wasn't real clear. So what we've done is we've defined 5 levels of care. And the first level of care would be a person who is in an emergency situation. That would be someone who's maybe had an accident, they're bleeding or they're swollen, someone that needs urgent care. So that's would be our level 1 type person that would come into the practice. A level 2 care person is someone who we have termed a limited care patient. And a limited care patient would be someone who knows that they need a lot of work. They're very aware of that. It's not that they don't know, but for whatever reason, they may not have the finances or the time, or maybe they're fearful or whatever, but they're not, they can't do comprehensive care. And so a great example of this was we just had a younger lady that came in and she was missing her front teeth. She's got other areas of concern as well, but she had been laid off from her old job and was currently looking for a new job and needed some front teeth, just the front teeth. And so we were able to make her a device that snaps in, and cosmetically it looks fantastic, and she has front teeth and she could comfortably go and interview for her jobs. She knew she needed other stuff, but we were on the same page. Like, we knew what she wanted, what she needed, and she's going to come back. When she gets employment, she'll be back in the office and take care of herself. So that would be our level 2 type person. Now, the next level is what I call discovery care, and that happens at the other end of the building or in our hygiene department. It doesn't necessarily happen down on the doctor end. But discovery care refers to a person who is coming in and they want to know everything that's going on, but they come in to get their teeth cleaned, and then we go tooth by tooth and come up with a problem list. We also look at their gum tissue and determine whether there's any, whether they're healthy or not healthy, and then what needs to be handled there. We do a soft tissue exam and a head and neck exam. So it's a very comprehensive approach to determining a problem list. So a person for discovery care is coming in to get their teeth cleaned on the initial visit, but they're also we're gathering all this information. So from the discovery care appointment, we start to move people, if they want to move forward. We'll move them to the 4th level of care, which is what we call complete care. And complete care is someone who we've had the problem list, we've formulated some options from them. We've been through the question and answer as to what might be the best option for them, and sometimes we have 2 or 3 options, and they'll pick one, and we're aware of what they want to do. They're aware of what they want to do. We've talked about the pros and cons of each one of them. They've figured out how they're going to pay for it, and we've figured out the financing, and we're moving forward. So once we're moving forward in this level 4 level of care, that would be someone who we're working towards them having no disease, no cavities, no gum disease, no oral cancer, obviously, and they're stable. We've replaced all of their teeth, and they're coming back into our ReCare program, meaning that we've gotten them stable. Nothing's changing, so there's no disease processes going on, and they're comfortably eating and speaking and chewing their food. So that would be a complete care, and that's our goal for everybody, if they want it. But that's our goal. When I'm talking to a new person that comes into the practice, I want to help them get to that point, because I think everybody deserves that. So we try our best to figure out what's the best thing for them. We try our best to help them figure out how we can work together to make it financially work for them, and then get them to that point. So that's our level 4 level of care. Level 5, which is, we need to make sure that we're up to level 4 before we get to level 5. But a level 5 patient is someone who wants to look their best all the time. And this is the realm of cosmetic dentistry. I absolutely love cosmetic dentistry. It's probably the most fun thing that we do in the practice, because it does really change people's lives. And I love hearing the stories, when people come back in and they're talking about how people have complimented their smiles, and things are just happening. But in this level of care, we would include whitening their teeth, porcelain veneers, porcelain crowns, maybe replacing some of the old silver or black fillings that are in their teeth. Maybe a combination of all those things, but that's our fifth level of care. It's important for us to know when a person comes in where they are on this continuum of care, these 5 levels. And so we try to discern that, and so we don't start talking to somebody who might come in for limited care and we're talking to them about lumineers or porcelain veneers and things like that. They don't want to hear that. I mean, people, they're not at that point. So it's important from a communication standpoint and for our ability to focus in and make our time most efficient with that person, that we know exactly where they are with these levels of care. And that's basically become our core practice philosophy, because I found that if we can all figure out where we are on these levels, it's much easier to communicate and everybody gets along a lot better, and we can give people what they want.